WMVO and WMVO.com's AM Knox County program. Thanks for joining us here today. We got two people in studio. I think this is like breaking the record that we're going to have two different guests in the studio here for the first time in a while, so we're looking forward to it. Dr. Swetlic is with us, Jim Swetlic from Swetlic Chiropractic and Rehabilitation. He'll be talking with us here, and then Mayor Matt Starr will be joining us as well. We were kind of joking that I was able to give Dr. Swetlic directions to get over here, and he made it just in time. So no, he's just down the road. The stone throw away from us here, right? So
we're just down, just one block away, just on the corner of Upper Gilchrist and Yelger Road, so right on the corner there.
All right, so a great facility over there, and this is awesome to have Dr. Swetlic back in here with us. Of course, we had Dr. Jake Overholt with us and Dr. Jim Jenkins with us as well. So those are the three, besides you and the other two, those are the three that you guys have right now, right?
Correct, yeah. And Dr. Jenkins is actually a doctor of physical therapy,
Mm-hmm.
and Dr. Overholt, who's been with me for since he graduated college, so 13, 14 years. So, and that's where we're at this point in time.
All right, excellent. So, for those who don't, I assume a lot of people that are listening do know you and things like that. How long have you been practicing here in Mount Vernon, and how long have you had this great facility that you have on Upper Gilchrist Road there?
Yeah, I've been in practice at Mount Vernon since 1986. So, actually graduated Mount Vernon, then Otterbein College, then Chiropractic College, and said I wouldn't come back to my hometown, but here I am. Best decision I made. So we love it here in Knox County. It's awesome. So.
Yeah, well, Dr. Swetlic, I have to always joke with people about how old I was so I wasn't born yet. We appreciate you joining us. So when we talk about Swetlic Chiropractic and Rehabilitation, we're talking about two different separate things because of what Dr. Jenkins can do on one side and what you and Dr. Overholt do on the other side. So tell us a little bit about the services there at Swetlic Chiropractic and Rehabilitation.
Yeah, originally I started out just a sole practitioner as a chiropractor, and my business kind of grew. And I realized I needed some help, so Dr. Overholt recruited him out of college, and he's been with me now for 13, 14 years. What an asset he is to my business. And then we really realized that physical therapy would be a really good match with our business as well. So we try to line people up structurally, and then we try to strengthen them back up so they can hold their adjustments longer. And so we had a physical therapist in our business now for probably about 14 years, and then Dr. Jenkins joined us a year and a half ago. So he was a professor at Ohio State. He has his PhD in exercise physiology. He's been doing physical therapy for many, many, many years. Interesting enough, too, he also was a Big Ten official. So he did Ohio State and the SEC, and so he gave me a couple little run-ins he had with Bobby Knight a couple times. So it's really interesting dude. So, but he's just a wealth of knowledge, and he is a complete hands-on physical therapist. It's unbelievable what he does. So very blessed to have him.
Yeah, he wasn't there when he threw the chair when Bobby Knight threw the chair, right?
I think he said he saw him a couple nights after that. So,
Dr. Jim Swetlic with us, Swetlic Chiropractic and Rehabilitation, and we thank him for spending some time with us. Last month we talked with Dr. Overholt a little bit about this lifestyle program that you guys are doing. So tell us a little bit about what this program actually is here.
Well, back in November, I hit that magical age of 60, and I've always been worked out and pretty staunch workouter, and but I got on the scale that morning and hadn't been on the scale for a while, and I thought, boy, that ain't good, and so I was just touching the 199.9. And I've never weighed even close to that before. In my mind, I always thought I was 180. So I told my wife that morning. I said, "Hey, I'm changing some things in our lives, and this is what I've been looking at a bunch of different options for some time." And I said, "This is what we're gonna do." And she's like, "Well," she wasn't really that interested because there's a lot of changes. But I said, "This is a very systematic approach we're going to go." And so after we looked at it, and we talked to quite a few people, and then the guy that's kind of the director of it is the director of WebMD. So we called him and talked to him, and it was a very well-placed scientific type of approach to how you should eat and what you should do. So So I said, I had got the bright idea. We're going to start this the week of Thanksgiving, which we did. And but it's been great. So within about less than 3 months, I dropped 30 pounds, and my wife dropped 30 pounds, which I don't know where she dropped her 30 pounds from. And we just started feeling really, really, really awesome. And so what we're finding is that traditionally, I think the food pyramid has some problems, but most people, when they're hungry, they just grab some bunch of carbohydrates, and when you're eating carbohydrates and the wrong ones, what happens is that all you do is burn the carbohydrates, and you just keep storing the fat. So the fat just keeps piling on, and the carbohydrates just make you hungry for more carbohydrates. So we changed the whole approach. So we're doing less carbohydrates, more fat, and more protein. But it's all planned out. It's a very systematic approach to your diet, and it's been wonderful. So we've been doing it now for about 7 months, and we both pretty much just maintained the weight that I wanted to lose 20, and I ended up losing 30, but I think I'm down like 27. That's about where I'm going to stay, and it's just it's been great. So it's not we don't call it a diet; it's a lifestyle change. Just teaching you how to eat properly and when to eat and what to eat. So that's what we've been doing.
So have you been passing that along to your patients as well?
Yeah, my whole staff has done it. And I think Dr. Overholt's lost like 30, 40 pounds. I think everyone on our staff is just done really, really well. So it's kind of fun because there's all different type of recipes we share with each other. But so we're certified health coaches now, and so we help people along that join up the program, so we can teach them what to do and how to do it. And it's like I said, it's I didn't want to reinvent the wheel. It's already been invented, so we're just following this program that we've obtained from the director of WebMD. So it's pretty cool.
So you can almost do threefold at Swetlic Chiropractic and Rehabilitation. You can do the nutrition side of it, do the chiropractic side of it, and the physical therapy side of it, correct?
And we can, and we have incorporated that with a lot of people. There's always anytime you're changing your lifestyle, there's a curve, because people are so used to just grabbing this and doing that. It's just like exercise, I think everyone should exercise 3-4 times a week. And most people get into it, and then they kind of, they slide off a little bit. So it's just something that you got to be mentally, you got to have your mind right before you change anything in your life.
Yeah. Well, I think it was almost 4 years ago now, I went on a keto diet, and I lost 23 pounds in 2 months. And I actually went to go for this physical exam thing, and I had actually, my back had straightened up a little bit because of the fact that I had lost the weight. My spine was able to have that pressure off there, too, and that's a part of this, right?
It's huge. I mean, and another thing, too, is when you're on the keto diet or low-carb diet, because that puts a lot of inflammation in your body. So carbohydrates puts a lot of swelling in your body, so your joints will swell up more, and so you're going to ache a lot more. My wife cringed the day that I told a lady that we were talking about diet and exercise and losing weight, and I said, if you've got too much junk in your trunk, if you're hauling around too much stuff in the car, the shocks your bottom out. So that's kind of what happens with your spine. So it's keto diet's a great way to go.
Yeah, I did it for so long, and then I like pizza, but I try to stay in shape and things like that. But that all kind of almost can go hand in hand, even with staying healthy and getting the weight off your knees and getting off of other joints, right?
Sure does. I mean, most of any of those joints, if you got too much weight on, it's going to squish that little padding in between the joint, and it's going to decrease the size of the opening in that joint, and it's going to irritate and cause some swelling, and you're going to get pain. So just by drinking more water, reducing your carbs, you can and a little exercise, you can make some big changes in your health. I know my cholesterol dropped 60 points in a few months. It was pretty incredible. So that was worth it right there.
Yeah, it was hard for me. Tiffany's doing a great job on this diet thing she's doing, but it's hard for me because the kids, Brantley, I just want dinosaur chicken nuggets, and you're like, oh, okay, cool, and you want chips with that, I assume, yeah, okay, cool, I guess I could just eat a couple of those, and it's kind of difficult. So a lifestyle change is a lifestyle change. It's changing in every aspect of it. Even when things like that come up, you're able to resist the temptation and stay away from that. So.
I don't like Dr. Overholt. He incorporated it for his whole family, so he's got his kids eating
very cool
as well. So And we have pizza, but we make our crust out of chicken.
Okay.
Chicken crust, pretty dang good.
Never heard of that. That's awesome.
It's really interesting. So there's just tons of different types of food combinations you can put together that's extremely healthy for you, and it's good.
Yeah.
So we're not starving to death. No, trust me.
Dr. Jim Swetlic with us, Swetlic Chiropractic and Rehabilitation. We appreciate him joining us here on the program. Got more to talk about regarding Swetlic Chiropractic and Rehabilitation here on the program. We do want to thank Tim Hortons Coffee and Bake Shop, Coshocton Avenue in Mount Vernon. It is always fresh, great donuts and wonderful sandwiches as well. I talk about low-carb things, and then I mentioned here about Tim Hortons. But Tim Hortons is fantastic, too. So
and they are. Yes.
We'll take this break, though. We'll be back, and more of AM Knox County is coming up. Welcome back. It is AM Knox County here on a Tuesday. Thanks for joining us. Dr. Jim Swetlic with us, Swetlic Chiropractic and Rehabilitation. We thank him for joining us, and it's great to have Dr. Swetlic back in studio with us here. And always great to chat about what's going on over at Swetlic Chiropractic and Rehabilitation. So, we talk about the lifestyle that you can get in to be healthier and things like that. If somebody's interested in something like that, Dr. Swetlic, in addition to maybe seeing you for chiropractic care or for physical therapy care, do they just mention it when they give you a buzz? Is that the best route?
They can just stop in the office, or they can call in and talk to the front desk, and then they'll direct them to the person who's taking care of all that. So,
yeah.
Yep.
Well, and when you go and buy food, it's always so dang hard. I was telling a friend of mine, I said, I need to eat healthy. I'm gonna go get some food, and I'm gonna get some healthy stuff. But then you look and you're like, I bet the kids would like pretzels. I bet they would like these muffins. And then you're like, this is not the right way to do it. But certainly, it's a lifestyle change, and hopefully you can get your kids on board. So
and it's a known fact that diet definitely controls a lot of your problems going on in your body. So you can control your diabetes through better diet and hypertension, and like I did with my cholesterol. So, but it's a choice people need to make, and if they have any questions or if they would like some more answers to it, then they're free to contact us, and we'll get them some information. So.
Yeah, well, we always talk about that if you wait too long on the chiropractic side and things like that, it can only get worse for you. It's kind of the same thing with the lifestyle thing. If you just continue to put bad stuff in your body as years go on, it's only going to harm you. It's not going to help you at all. So you got to reach a point where you're finally saying, all right, enough's enough here. And
you don't want to put gas in your car that has water in it.
Exactly.
Kind of what I was doing for some point.
Dr. Swetlic with us. We appreciate him joining us here on the program. And I will say this, having you back in the studio, I have to watch my posture a lot more than when we were on the phone, because I could just see a slouch down. So I'm trying to.
I've never seen you sit more erect.
So trying to make sure that I'm doing the right thing here. But well, of course, with a place like Swetlic Chiropractic and Rehabilitation, during you guys had to deal with the COVID-19 pandemic, and I know you were limited and how many your hours were limited and things like that. So where are you at in terms of your hours right now? And I know you're kind of interested in getting some more doctors in there. So.
Yeah, our hours are still limited just because we are actively recruiting some new docs to try to fill the slots so we can bring in more patients on that have been patiently waiting to get in to see us. And so that's where we're at this point in time. So, it's when you live out here in the great Knox County, it's beautiful out here, but sometimes it's a little harder to recruit people to come here. Many times the doc wants to come, but the wife doesn't, and sometimes the wife wants to come and the doc doesn't. But we're just waiting to find the right match, and we will find it. We've always been successful in the past, so it'll happen here soon.
And are you looking for a position like Dr. Jenkins has, or like that you or Dr. Oberholt has, or is it a combination of both?
Just a combination.
Yeah.
Just trying to find the right chemistry to find the right people to bring on board with us.
All right, cool. And you want to, obviously you don't want to mess with the three great docs you have there, so you want to find somebody that fits right in there. So, Dr. Swetlic, I got to ask you too. I'd be remiss to not ask you about the stem cell things that you typically do. I know you haven't been able to do them because of COVID. The presentations, are you up to doing those again?
We're starting to gear back up. We're doing a few this coming weekend, and we'll start doing some more in-house classes and stuff on not only on the stem cells, but I think we're also going to do some classes on physical therapy and chiropractic as well. So, we're looking into that as we speak.
And we always tell people that the stem cell thing is almost a last resort, right? It's not like you're going to come in and be like, "Hey, I've been having some back pain. Can you inject me with those stem cells, Dr. Swetlic?" That's kind of a last resort, right?
It is, yeah. And there's a lot of people that have just chronic ongoing pain. They've tried everything else, and they're willing to try something else natural that's been proven that many people have had good results with, including myself. So just an option, and I'm not saying that's going to be the right option for them, because we're not against having surgical replacements on hips and knees and stuff, but some people just don't want to do that. So we're just giving an option to people.
All right, so there's a opportunity. So we talk about chiropractic care. What is probably the most that you see that people come in for in terms of what their chief complaint probably is?
Number one probably is obviously lower back problems, and then number two would probably be neck problems, and neck problems is really becoming a bigger growing problem, because majority of people, I think kids are coming out of the womb now with an iPad or a cell phone, so they're constantly hunched over, looking down, either playing a game or texting or whatever. So posture is key, man. If you're slouching too much or looking down too much, your muscles, ligaments get retrained, and then before long, that natural curve you have in your neck goes away, your neck straightens up, and then it creates a lot of problems with headaches and just chronic pain in your neck and upper back. So that's why we find that many times the adjustment really helps, but you got to also do some therapy as well, or at least do some home exercises. Work on your posture, raise your screen up, don't slouch, don't look down. Always keep your eyes level with the horizon. Look straight ahead. So it makes a big difference.
Yeah, and one of the things that I think you mentioned before that kind of surprised me is the fact that you actually are putting the most pressure on your spine when you're just sitting, right?
Yeah, they did it. They did some testing on this some years back, where the poor college kids need some money for the weekend or whatever. So they would put them in different positions and put probes in the discs and find out what position put the most pressure on the disc. So sitting and bending forward slightly, or bending forward, puts more pressure on the disc than anything, even more than when you're standing and bending forward. So, and what do we, it's pretty much sedentary life, especially the last 18 months with the COVID. A lot of people are sitting much more than they had in the past, not getting out of the house as much because a lot of people were working from home. And so it's really a good idea, even when you are working at home, to get up and walk around the house, a little bit. If you're on the phone, you can be on the phone walking, and it just makes a huge difference. So sedentary is really hard on you.
Yeah. I think about it when I'm sitting at home and it's like a Saturday. I just want to be lazy today, but you got to get up, you got to move a little bit, or else you'll get yourself in a situation where you just are not feeling great afterwards. So, Dr. Swetlic, you mentioned about the texting and different things like that, and how that can affect it. And that's something that are you seeing that more in younger people than it is in maybe the older people?
We are. We're seeing a whole lot more with younger kids with neck and upper back problems, headaches.
Yeah.
Headaches are terrible with that, because, like I said, once that neck starts going forward too far, you don't realize that your head, when it's perfectly balanced where it's supposed to be, weighs about 12 pounds. And every inch that your ear gets in front of your shoulder adds an extra 12 to 15 pounds of weight on it. So when you see someone's chin almost on their chest, they're putting a lot of strain on their upper back and on their neck. So they're going to probably end up with some neck and some headaches eventually from that. So.
Yeah. Well, I know, I had some back problems with my lower back, and it was probably, a lot of it was because I have some really bad posture. So but you go throughout, when we talk about training our bodies, training our muscles, is that if you're doing it for so long, either looking down and texting or looking at the computer screen or not having the proper posture, it can become, your muscles kind of get trained to be in that position. That's why you're in that pain, right?
Yeah, you got to think about it. I mean, posture is subconscious, so you can tell yourself, I'm going to sit up nice and straight and stay this way all day. And the next thing you know, 20 minutes later, you're all slouched over. So it's a working process. You got to constantly work on it and think about it. So.
Yeah. Well, I'm working on it.
Yeah.
It's hard to do it when like you say, you kind of just slouch down. You're like, whatever, this is what I typically do, and then So I had to make sure today that I was good to go when Dr. Swetlic came in, and we weren't on the phone for the first time in a long time. So we appreciate Dr. Swetlic joining us.
Yeah.
Tell us how we find out more information about your practice with either you or Dr. Overholt or Dr. Jenkins, and how maybe they can get involved with this lifestyle program that you guys have, or chiropractic care, or physical therapy care.
Yeah, we're just on the corner of Upper Gilchrist and Yager Road, just directly south from WMVO.
Yeah.
At the four-way stop, and you're always welcome to stop in and ask questions, or you can reach us at 392-1407, and set up something to come in and talk to us.
All right, and don't suffer anymore today. If you're having pain and things like that, the best time is to get after it now, and then make it easier for your treatment as well. Dr. Swetlic, Dr. Jim Swetlic with us, Swetlic Chiropractic and Rehabilitation. We appreciate him joining us here on the program today. We're going to take this break. We'll come back and have more of AM Knox County here on a Tuesday.